Welcome to Module 2, Session 1, Person-Centered Communication for FGM Prevention. This session will introduce person-centered communication for FGM prevention, its objectives, the principles behind this approach, and the techniques to carry out FGM prevention counseling. We will introduce the ABCD steps in FGM prevention counseling. The learning objectives of this session are to understand the purpose and techniques involved in person-centered communication for FGM prevention, and to know the steps involved in the ABCD approach. What is person-centered communication for FGM prevention? It is a counseling technique designed to empower women to abandon the practice of FGM. It can be used during any clinical encounter, preferably during routine health checkups, such as antenatal care, postnatal care, immunization services, contraceptive services, or any other sexual reproductive health services. Through this technique, the healthcare provider encourages women to explore the main reasons for supporting FGM. These reasons are then discussed, and the healthcare provider helps to dispel any myths and helps her to reassess her beliefs on the practice. The main goal of person-centered communication for FGM prevention is to empower women to reassess their beliefs on FGM in order to abandon the practice. The specific objectives of person-centered communication for FGM prevention are to enable a respectful discussion about FGM between the healthcare provider and the patient or the client, to explore and understand the woman's personal views and beliefs about FGM, to provide information to the woman, including alternative views to her personal beliefs on FGM, to motivate her to consider and discuss change, and to plan for follow-up visits, and to provide referrals to outside agencies or organizations if these are available. This technique, which is delivered by healthcare providers, is based on the following key principles. First, that FGM is a medically unnecessary practice. It harms the health and well-being of girls and women. FGM violates the rights of girls and women. Individual and collective beliefs and values influence attitudes towards the practice. To change a behavior, women must first reflect on and question the beliefs and values that support this behavior. And finally, decisions made by the woman rather than by the healthcare provider will be more likely to be successful in changing and maintaining her ongoing behaviors. Antenatal care visits can be an effective setting for person-centered communication for FGM prevention. This is because the repeat encounters allow healthcare providers to talk to women about FGM and reinforce messages. Antenatal care visits have a health promotion focus, especially the first antenatal care visit, when there may be more time to have such a discussion. Pregnant women might give birth to a daughter or have a daughter at home who's at risk of undergoing FGM. While antenatal care settings can be an important setting, it is not by any means the only clinical encounter where these kinds of discussions can take place. An important note, healthcare providers should remember that while they must respect the perspectives and beliefs of their clients, they also need to play a role in working towards ending FGM. This slide shows the ABCD steps that are part of person-centered communication for FGM prevention. On the right side, you see a graphic, which is also a job aid that healthcare providers can use to guide them through these steps in these conversations. The next slides will go through each ABCD step one by one. The first step, A for address FGM, is when you can confirm the woman's FGM status and inquire about any health conditions that she might have that are related to FGM. During this first step, you can first welcome the woman in an approachable manner. For example, you can say, "Thank you for coming in today," or "How was your journey here today?" You can ask the woman about her FGM status during the clinical history taking. You can say, have you heard about FGM, or can I ask you a few questions about this? If you confirm that she has undergone FGM, you can ask her about any clinical symptoms that she might have had and that she may be concerned about. These might include vaginal discharge, urinary symptoms, previous complications during pregnancy, worries or fears, or psychological or sexual complications. It's important to mention that some women might not consider FGM types 1 or type 4 as forms of FGM. If they are asked about their FGM status, they may therefore respond that they have not been cut despite having had FGM. So it is important to confirm that she has or has not been by asking further details. So you can ask, for example, about any special rituals that she might have gone through, or about any health complications or any scar tissue or any other alterations of her genital area. The next step is to assess the woman's views and see if she supports FGM, and if she does, what are the reasons for supporting it. The next step is to assess the woman's views about FGM. You can assess how she feels and if she thinks the practice can continue. For example, you can say, I would like to ask you some more questions about FGM. Would this be okay with you? Or, do you support the continuation of FGM? Depending on what she says, if she says she thinks FGM should stop, you can reinforce that. Or, if she's unsure or she thinks FGM should continue, you can say, thank you for sharing this with me. I would like to try to find out why you feel that FGM should continue. And then you can summarize the woman's reasons in your own words as a statement, not as a question. You can say, if I understand you correctly, you think FGM is important because, and then repeat the reason that she's given. So what should you do if a woman says that she does not wish to discuss FGM? You can try to encourage her to do so, but without being overly pushy. The healthcare provider must reassure the patient that the conversation will be kept private and that they can stop talking about it at any time if she's uncomfortable. For example, you can say, please be assured that anything we discuss here is in the strictest confidence. Does that change your mind about talking about this subject? And if she continues to decline the conversation, the healthcare provider should respect her wishes and offer her the chance to return if she changes her mind. She should also be offered any available support, and then you can move on to the next part of the clinical consultation. The next step is around beliefs. This involves discussing and challenging beliefs about FGM. You want to find out what are the woman's beliefs about the practice. During this stage, you can invite the woman to rethink the aspects of FGM that she sees as positive by introducing the concept of beliefs. You can say, you have just mentioned the reasons why you think FGM should continue. Or, however, did you know that many of the reasons given by community members for supporting FGM are ideas passed through generations without anyone questioning them? We call these beliefs. You can contrast the woman's reasons for supporting FGM with facts. For example, if she mentions honor, you can say, this is interesting. You see FGM as the only way to ensure your daughter becomes a respectable woman. Then you can ask her how she feels about what you have just said. For example, you can say, I understand this has been a lot of new information to process. How are you feeling about this right now? The next step involves change, exploring the possibility of change. In this step, you can invite the woman to reflect on change by highlighting that changing tradition is in fact possible. For example, you can say, I would like to take a minute to discuss change with you. Would this be okay? Or you can say, changing our beliefs is possible, even if these are long-held beliefs. You can invite her to think about what was discussed and remind her that the role of the healthcare provider is to promote the end of FGM. You can say, as healthcare providers who care about your well-being, we promote the end of FGM. You can ask her how she feels about what you have just discussed. You can say, how does this make you feel? At this stage, the woman may or may not think changing her views on FGM is important or possible. She will need time to think about what has been discussed. The healthcare provider should avoid trying too hard to convince her that change can happen. Their role is to listen attentively and to offer support. The healthcare provider can ask if the woman would like to think about what was discussed during the session and perhaps come back for another consultation. In such cases, the healthcare provider should remember to tell the woman that even if she needs more time to think about this, they can say, as healthcare providers who care about your well-being and the well-being of the community, we promote the end of FGM. The next step is discuss and decide. At this stage, you can support the woman in talking to other members of her community about FGM. At this stage, you can invite the woman to discuss change with a person she trusts and who may also be supportive of ending FGM. For example, you can say, I would like to invite you to reflect on the things we discussed today when you go back home. Perhaps you could share them with someone you trust. It's important to document the key findings and the key discussion points from your consultation. The healthcare provider can write down whether they did steps A, B, C, D of the counseling technique and how the woman felt about FGM. This will help with repeat visits as well. This last stage is to end the discussion, to develop a follow-up plan, and to provide any referrals as needed. You can check if the woman has understood everything that has been discussed and ask if she has any questions by asking, do you have any further questions? Or telling her, you can ask me anything that is not clear. You can offer other support services and/or a follow-up session as needed. For example, you can say, the following support groups are available if you need any help or if you would like any additional information. So to summarize, person-centered communication for FGM prevention is a person-centered approach. It's designed to empower women to abandon the practice of FGM for their daughters. The goal of the person-centered communication for FGM prevention approach is to help women make well-informed and voluntary decisions about FGM for their daughters. It's not about convincing, but encouraging women to choose not to cut their daughters. Women should be encouraged to explore and resolve internal conflict about FGM beliefs. Healthcare providers working in antenatal care settings or in any other clinical consultation are in a good position to deliver person-centered communication for FGM prevention. Additional resources and information can be found on the subsequent slides. For example, we encourage you to go to this page here, this last reference, which is a training guide, a facilitator's guide, and there are also additional slides and resources and job aids on person-centered communication for FGM prevention. Thank you for your attention.